Hi, everybody. Welcome to a very special edition of Conversations with Calvin, We the Species. Uh, uh, I'm back with Dr. Tara Chalakani, who is the new CEO of Preferred Behavioral Health Group. We're going to talk about that. I've done two of these sessions with Dr. Tara. Dr. Tara, it's just easier. And this is our third get together with Preferred Behavioral Health. And how this all came about real fast is I sent Dr. Tara a note that I'm really bothered. And I'm pretty grounded. I'm a Rutgers guy. I'm grounded, but I'm pretty bothered by the things that I see going on in the world. The war in the Middle East and the war in Ukraine and the threat of nuclear war and COVID virus and the violence in New York and the migrant situation. There's and it bothers me. It bothers me, and I know it's affecting me, and I wanted to address that, and I said, let's just talk about the whole institution of mental health, because as you said, we said, one out of every two people in their lives have had crises, and there's a stigma, and enough people don't go out to seek the kind of help. So we're going to talk about some really important issues today, and I'm done with my quick Johnny Carson monologue, and I'd like to introduce Dr. Tara Chalakani, a little bit of a bio, and talk a little bit about preferred behavioral health, and then we'll go into some things. Take it away, Tara.
Well, Calvin, thanks so much for having me back and making mental health a priority and wanting to talk about it and not being afraid of it. Because even though it's 2024, we still live in a world where people are reluctant or even ashamed to talk about mental health issues, including addictions. And we really need to begin normalizing it so that we can destigmatize it. So thank you so much for that.
My pleasure. My pleasure. A little bit about Preferred Behavioral Health Group. Um,
We are a wonderful organization that has been serving New Jersey since 1978. We serve the entire state for therapy and psychiatry through telehealth. And we are also physically present in 14 counties in New Jersey. And we provide an entire spectrum of behavioral health services for every stage of life in the office, in home, in schools, in community. We have residential programs, day programs. So we really hit the mark and cover all the bases. And I always say the easiest way to describe what we do is we don't have a hospital. So we don't have that, but we have everything else. And we are here to serve the citizens of New Jersey, often in their darkest time, but we are here.
which is a segue. I just learned the other day the 200,000 people die each year from overdoses.
Mhm.
I don't, again, I don't know enough for sure, but I don't know if we as a society are doing enough in this level. And then preferred behavioral health is there to help people and to guide people. And again, people, I don't think enough people take that kind of opportunity. But a little bit about the world of overdosing.
Well, like you said, I mean, it's sadly still very prevalent. And with now fentanyl being so mainstream and other threats like xylazine, we have a lot to fight out there in the community. And we provide substance use services, and peer support services are a huge part of that because research has shown that people respond better more to someone that's walked a mile in their shoes and has come out on the other side than trained professionals with licenses and a million, letters after their name. So peer recovery support is a huge part of what we do, but prevention is key. And that is something that is not really prioritized in New Jersey or elsewhere. And very often in our world now, we think of prevention as harm reduction, which is needle exchanges and safe spaces to use drugs. But I feel that that is death prevention, which we want 100% without a doubt, in conjunction with peer recovery and traditional substance use services. But I feel like we have to stop putting out fires and go back to the source. And we have to start in schools. We have to start with kids. We have to educate them. You know, we know not to litter. We know not to start forest fires, right? Because we all know Smokey the Bear. And I know I'm dating myself, but I remember the commercials with the Native American man crying over
Peter,
litter. You know, those things really impacted us. And we need to do more of that when it comes to the use of drugs and alcohol, because I think we start too late. I know the DARE programs traditionally in New Jersey, they started in fifth grade. We need to go way, way further, you know, and really teaching kids to value themselves and teach them skills so that they have the wherewithal to refuse if they see someone using. So, I mean, it's a heavy, heavy topic, Calvin, and you know, I know we were chatting beforehand that we could talk about any one topic, mental health related, for hours on end, but I do feel strongly that prevention is really key.
okay. Um, this is kind of an overused discussion, but I don't think it's enough. I don't think enough of the message gets out. But talking about youth, our youth and mental health crises, and just again, it's in the news all the time. But social media is fueling so much of this. The youth mental health. We we we've got a youth mental health crisis going on, and you at Preferred Behavioral Health do a lot of work with youth.
We do. We do. One of our biggest youth programs is our Children's Mobile Response, which is 365 days a year, 24 hours a day. And the acuity and the demand for crisis services has escalated over the last 3 years. And we're seeing unprecedented number, but unprecedented need. But getting back to what you brought up regarding social media, I will say this, because I don't want this to all be gloom and doom, that without social media, I don't know what the COVID-19 pandemic would have looked like for kids, because at least social media and their screens provided them with some normative, age-appropriate social interaction that they wouldn't have had otherwise. So I think we have to, look at all sides of the spectrum. But the overarching issue with social media is that it certainly does not build social skills. It certainly does not replace human interaction. Excuse me. But the one problem is the negative, the downsize. For girls and even guys, it's body image issues. It's devaluing someone's self-worth and sense of self because of the comparison to others. Excuse me. I'm so sorry, Calvin. I hope you
Nope,
edit this.
that's fine. You can hydrate.
I have a tickle in my throat. So it's the body image issues. It's also the very flagrant bullying and aggressive behavior, which is what we deal with a lot in the mental health realm. You know, when we're working with youths that are struggling with issues on social media, it's usually being bullied, being exposed to things that are emotionally distressing, being exposed to content that is way over their heads and too much for them to comprehend. And the human brain is the human brain. It is what it is. It's not like in 2024 babies being born with, an upgraded brain, like we're getting an updated iPhone. It develops the way it develops, and it also develops in relation to what it's exposed to.
Um, it's funny, you talked about bullying. I'll just give you my little perspective. I was bullied, uh, grammar school, high school, bullied, made fun of. I was tall, I was goofy, and just the lasting effect. I never forgot that. I never forgot that, and it's been in my consciousness. So it's been in my consciousness my whole life. Maybe I was smart enough to overcome that, but I mean, I wrote about it in my novel. My character was bullied. So what I'm saying is, as a young person, a youth who's bullied, that's going to stay with them, correct, for a long, long, long time.
Of course, it's embedded in our brains. We don't lose anything that we're exposed to or that we experience. And I don't know. I'm making maybe a leap, but I think probably everyone gets bullied in some fashion, whether it's by a sibling or something. I mean, I certainly was bullied in school, but the issue is that when I had a bully, I could go home at the end of the day, and I didn't have to worry about that person until the next day. And on a Friday, I didn't have to worry about that person until Monday. And in the summer, I didn't have to see them for 3 months. But we don't have that anymore. And so you go home, but if you're on social media, that person can access you or their friends can access you. And even if you're good about not using social media or blocking people, friends can send a screenshot. Oh, look what so and so said about you. So it's really hard, even if a child's parents have great boundaries or discipline as it relates to screen usage and screen time. We can't control the whole world around us.
Okay. Moving on to prepare for you. I've done my digging and I did a lot of reading about suicide. Um, and actually, in my novel, which I'll throw up there, there's a tortoise in my hair, Journey of Spirit. There are elements of suicide in the novel about a character and suicide, and I won't say anything more about that, but there are elements of that. So it's been in my consciousness. I'm not suicidal, but 50,000 people a year die from suicide. It affects males 4 times as much as women, and preferred behavioral health. If somebody picks up the phone and calls you or calls 988, that 15-minute call can save a life. So talk about suicide. This is a wide open, but I don't know if we all realize just how. I mean, 50,000 people a year is a lot of people to lose.
Yeah. And yes, it does impact men more than women. And just to look at the flip side of that, women are twice as likely to access mental health care than men.
Wow.
So, and there's been a lot of debate about why is it so? And it's like, oh, well, women are more open with their emotions and things of that nature. And it's, they're more inclined to be open, talk to a friend, whatever. But whatever reason you kind of label it with, the bottom line is all roads lead back to our culture of stigma and the culture of, being macho. You can't cry, you can't show your feelings. And that's why I commend you and anyone who brings this to mainstream awareness, because if we keep talking about it, it becomes more part of just who we are and our culture. right? That it's okay to seek mental health treatment and it's okay to talk about it. And it doesn't matter if you're a man, woman, it doesn't matter your age. Mental health issues, mental illness impacts everybody. It does. Because if you can sit here and tell me you've never been anxious, you've never had a bout of depression, that's wonderful, but someone around you did. If you live in a household of four people, at least one of them has been through something mental health related. So we don't escape this life without having exposure to it. So we need to reduce the reluctance to acquire the help.
So you have systems built into preferred behavioral health that people, patients and people who reach out to you, you can counsel them. And is it the hardest thing about the whole thing about suicide is the whole institution of reaching out for help. People don't do that, obviously.
Mhm.
And should more being done, should more stuff be done to prepare people and to educate people and to tell them that there are so many sources of help like what you guys do? Are we doing enough of that to get that message out that there's so many people here that want to help you?
Well, I don't think that we can ever do enough. I'm sure that's the sentiment of all of my colleagues at Preferred as well. But I will say that in our state of New Jersey, we are working on it. Right now, there are several organizations that are working on a statewide zero suicide initiative where everyone in our organization gets trained on assessing for signs and symptoms and really making it part of everything we do across the board and having all of our staff educated. We do have a program in New Jersey now. The funding is called NJ4S and it's support services in schools. So we're providing the prevention that I talked about, which makes me very happy, and mental health services with mental health linkages to K through 12 students in public and charter schools. So we are doing more. I will say that more is happening, but it's still not enough because there are too many people who are going without services or can't acquire them for some reason. But again, people like you who mental health isn't your realm, it's not, your job 5 days a week, but you value it and you put it on people's radar and you use your influence. And that is just priceless. It's invaluable. So I thank you for that, and anyone else that isn't afraid to speak about mental health issues and bring it to the forefront of everyone's mind.
Yeah, again, I should have, maybe because I'm a guy, I should have at different parts of my life reached out for help. Not that there was any consequential, but I know I should have reached out. Maybe that's why I'm so sensitive to it now. I know I should have reached out and asked for help, but I never did it because I was a guy and I got lost. I would never ask directions. There's 100 people on the street. It is a gender thing, as you said, and you just said something really interesting. Women go for help so much more than a man does. But and I'm glad to hear that the state of New Jersey is doing so much more in that realm. And 988 is the phone number, right?
Yes, that's the National Suicide Hotline.
Right. Okay. And again, you guys preferred have all kinds of um, sources for people to reach out to you guys. Uh,
Yes.
I know we're just skimming over things because there's just so much here. The other thing I was always curious about uh, uh, is seasonal affective disorder. Uh, you know, People are cooped up in their houses and it's cold and uh, how do you guys uh, a preferred behavioral deal with seasonal effect? Actually, why don't you actually define it?
So the broad stroke is that when we have reduced exposure to sunlight, that creates a dip in our neurotransmitters in our brain, which can create depressive symptoms. So a lot of people are aware of it. They know that in the winter months, and these are people that I'm saying are already in care and connected to a therapist or a psychiatric prescriber. They're very well aware that, winter's coming. It's not a good time of the year for me, so I need to be mindful of it. So, I mean, any prescriber of medication, any therapist who works with their clients that have mood disorders of any kind, they're typically mindful that this happens. So I don't know that we would necessarily just treat someone for seasonal affective disorder and nothing else. I think it's part of the package, so to speak, or part of the process of working with someone through a mental health issue. But it's really important to get outside. I know it's freezing, but even a 10-minute walk, bundled up, getting fresh air, getting the ambient light on your skin, it's helpful. It really is. So anything that we can do to get outdoors is really important. There are artificial lights that people purchase online on Amazon. They're not super costly and they expose themselves to a little light every day. But the
No,
bottom line is really just being aware, knowing that it happens, and what are your supports? Who are your supports? What are other things like excuse me, that are in your toolbox that make you happy? Is music your thing? Do you like podcasts like Calvin's? TV show. I know a lot of young people, they'll binge watch something on Netflix if they're feeling down. So there are other things that we have at our fingertips, and exercise is always the biggie. And I think that the lack of sunlight or exposure to sun is the big overarching issue for seasonal affective disorder, but people also become much less active, and physical activity is really natural medicine. It's a natural remedy for anxiety, depression. And I've met with providers who have said to me, if this person has anxiety and they're not willing to exercise or work out 30 minutes a day, then I'm not going to be able to work with them, because there's really nothing
that
else that I'm going to be able to help them with if they don't help themselves. So just moving your body, you're releasing feel good hormones. And I mean, I can even say for myself that in the summertime, I'm walking, I'm biking. And in the winter time, I can't do that because, right now it's whatever, 24 degrees. So it doesn't work. But then we have to be mindful of finding other ways to stay active, whether you're looking for a workout on YouTube or you have a gym membership or something that creates movement, because there are ways that we can help ourselves to get over the winter hump.
you said something really interesting. Exercise. Um, I've been an avid exerciser. I don't walk, but I do exercise bike. But there's nothing, if there's nothing like the feeling after I do an hour and a half workout. My goodness, if I could bottle that, put it in a little bottle, endorphin, uh, that stuff is really powerful. Um, and to kind of show you how powerful it is, no names mentioned, but I know of somebody in my world who was diagnosed with bipolar,
Mhm.
by PTSD and bipolar, and this person has gone on to do voracious, monstrous amounts of exercise every day. And he became a world-class athlete, and I'm pretty close to him every day, and there's so much endorphin going into his body that it obviated and did away with the need. And I don't know if that's medically acceptable, but I mean, I don't know, but He's got a wonderful life and no meds, and he's living off the endorphins, the exercise, which you just talked about. That's how powerful it is.
And diet is huge too. There is a lot, and I think what happens, Calvin, is that when someone is really suffering and struggling, it feels so enormously out of their control. But yet there is so much in our control, like the movement, like what we put into our bodies, what we consume, um who is in our bubble, what are we surrounding ourselves with. So there is a lot in our control, and once we participate, let's say, in an activity like you're talking about, how you want to bottle those endorphins, I think once we start it and have the return on our investment of time and energy, that sends the message. But it's just kind of getting over that initial hump and motivating yourself to start. But there is a lot that we can do for ourselves, for sure.
Right. And maybe if more people exercise, that endorphin rush would get them over a lot of helps of daily living. And you also said something about diet. Uh, uh, I've been following nutrition for a while. I stopped eating uh, red meat in 1975. And I'm walking around with zero coronary artery plaque, and I'm very proud of that at my advanced septuagenarian age,
Mm-hmm.
not to have any coronary artery plaque, and that gives me a sense of well-being. It's kind of euphoric.
Mm-hmm.
I don't think I'm Superman. I don't shovel snow and stuff. But so diet, as you just said, very, very important. Um, is supplementation is taking supplements, vitamins, is all that, does it contribute to better mental health, having the diet and maybe some supplements?
Absolutely. I mean, listen, I am a very holistic practitioner, so I look at the whole person, and it's never one thing. It's never just therapy. It's never just medication. It's never just exercise. We are multifaceted human beings, but supplements absolutely contribute to improved mental health. And actually, one of the biggest supplements that are so important is vitamin C. And we think about vitamin C a lot at this time of the year because we don't want to catch a cold, we don't want to get the flu, we don't want COVID, right? So a lot of people are more vitamin C focused, but it actually helps our mood just as much as it does our immunity.
Wow.
Vitamin D is another big one, and that's another contributing factor with seasonal affective disorder. We're having reduced exposure to the sun, which reduces our vitamin D levels, which impacts our mood. So vitamin D supplementation, absolutely. And I mean, there's so many. It's fish oil, it's it's the B vitamins. So
Vitamin D.
there you go.
There
There
you
you go.
go.
Does it have K2? It has to be vitamin D with K2.
I don't, this is D3. I don't even know.
You want D3 with K2.
Okay. K2.
Yes.
I appreciate that. I do. And I do remember from my pharmacy days that when you're taking vitamin D, you got to take calcium with it because they each help each other
That's
get
right.
absorbed.
That's
I
right.
remember that. So that,
And we're all different, right? We all have different beliefs, and some folks are very Western medicine focused and whatever my doctor says. And absolutely, like if that's what you like, then absolutely. Some people are more interested in holistic. Like, for instance, I believe in chiropractic care, and I believe that also impacts your mood. So, that will take you down another path. And then there are naturopaths and alternative and complementary medicine practitioners who are more well versed in supplementation and performing testing that Western medicine doesn't necessarily participate in. So it's really about the individual. And the bottom line is we want to get someone to their optimal health, to their best self, their well-being. And in a way that they're comfortable. So whatever that looks like, that, so be it. The bottom line is get the help that you need and do it in the way that you choose.
The last we can go on for hours.
I know.
We're not. But you have a private practice.
I do. In addition to my role as
Yes,
CEO.
that's right. You have a private practice, and in doing my due diligence as a journalist, I read about in part of your private practice, you talk about higher consciousness. If you could define that and just put a little light on that, that's the last thing I'm going to ask you for today. So, what do you and what I mean? I'm very spiritual, and that's why I wrote a novel. Is that part of a higher consciousness, the spirituality?
For sure. And I mean, I am a licensed practitioner, so I am highly clinical, but that isn't just who I am. I am very spiritual, and I tend to attract a very spiritual clientele to my private practice. But I am highly focused on treating trauma. And a lot of the work and a lot of the modalities that work on treating trauma is very much focused on our unconscious, what isn't on the forefront, which isn't in our thought processes that we're aware of, but more of underlying behaviors and consciousness. And there's so much that drives who we are that isn't in a textbook, it isn't scientific, right? We are more than just this. We do have a spiritual component. And again, this is a topic certainly that I could, chat with you about for
Yeah.
hours on end, but definitely in the work that I do one-on-one, there is a huge spirituality piece and a lot of work of really working on our higher consciousness and our highest self, our best self.
Okay. Maybe we're gonna we're gonna do a wrap now, but the higher consciousness stuff. I was sitting in this chair a few years ago, texting with a friend of mine who actually is a psychedelic guy, mushrooms and psych. We'll talk
Mm-hmm.
about that another time. But we were just texting, and my picture of my mother is right over my computer there, and he asked me something, and I wrote yup, and I put my phone down, and I had prior to that, I've been listening to my mother's favorite song from Mary Alonso for 3 days, just obsessively compulsive. Another thing we can talk about, OCD. There's so much stuff. I'm like this conglomeration. But anyway, after 15 minutes, I just randomly picked up my phone, and there in the outgoing message typed was the word mom.
Wow.
No, it is a wow. By the way, it is a wow. I didn't type it, and I don't have voice activation, and there was no reason. So I've gone on to ask about 50 techie people. I mean, everybody I encounter who's any kind of a techie, how did that? Nobody's given me an answer on the technological side, but I know that my mom came out because I was so into her. She came out of wherever she was, got permission from the boss and type mom, just let me know if she was. So that's higher consciousness, correct?
Yes, for sure. And I love to hear stories like that. And it, validates what I believe. And again, we're all different, Calvin. So I'm not here, and I'm not certainly saying, and representing preferred behavioral health in that realm. I'm speaking of myself as an individual, but, we all have our individual beliefs. And I certainly feel very strongly. I mean, this is not it. There's more to life
Correct.
than what's here on among the living, so to speak. But I love to hear stories like that. And
Oh, we could talk for hours.
yes,
I
yes.
I wrote a novel. I wrote a novel. I spent 5 years of my life writing a novel telling of these kind of stories, and they're my stories. They're inexplicable stories
Mhm.
And that's why maybe next time if we come back, you come back, we can talk about higher consciousness. Uh,
Absolutely.
so you got to run because you've got duties as a CEO. Dr. Tara, thank you so much for
Well,
your
thank
graciousness and
you.
time. Do come back. Please come back because there's so much more to talk about.